Does this look familiar? Have you ever found yourself in contention and conflict with a coworker or a supervisor? Conflict may arise over a difference in values and beliefs, or over a belief that one person is right and the other is wrong. This presentation will take a closer look at conflict management and delegation. My name is Mark Rowley, and I'm a BSN student at Florida State College of Jacksonville. So in this presentation, we're going to talk about conflict in the workplace. We're also going to talk about delegation of tasks, and also talk about what a healthy workplace or work environment looks like. And again, my name is Mark. Thank you for watching. It is very important to first define what conflict actually is. Conflict is defined as discord that results from differences in ideas, values, and feelings between two or more people. Kenneth K., a social psychologist, writes that conflict is neither good nor bad. In fact, conflict is vital for change to occur. We will review the interpersonal conflict of a nurse who's tired of picking up after others and believes that they work harder than other nurses. But before we begin to resolve a conflict, it is important to understand conflict management and to know the stages of the conflict process. The conflict process details 4 stages. The first, or antecedent stage, is called the latent stage. There's usually an organizational situation or precipitating event that is driving or causing the conflict, such as a staffing shortage or operational change. The second stage is perceived stage, in which the employee has intellectualized a conflict within their role. This can often be resolved through communication and clarification of roles. The third stage is felt, in which the employee is emoting fear, mistrust, and even hostility. The fourth stage is manifest, when the conflict is very apparent and employees are now withdrawing or even competing with one another. Once you identify the stage of the conflict process, we can move into conflict resolution and strategies. One strategy for conflict resolution is compromising, where each party gives up something it wants. Another strategy is competing, when one party pursues what it wants at the expense of the other party. Competing is a win-lose situation. Another strategy is cooperating or accommodating, when a term or agreement is applied to the employee who concedes. Then there is smoothing over, when one party attempts to pacify the other party. Avoiding is when both parties avoid dealing with the conflict because of esteem issues, or they believe that the cost of dealing with the issue exceed the benefits of solving it. Another strategy is collaboration, when both parties set aside their original conflict and they establish a new common goal. They share mutual responsibility, and this is truly a win-win situation. When managing conflict that interferes with unit cohesion and effectiveness, such as the nurse who thinks they're working harder than everyone else, consider the following strategies. Confrontation is when a team member may inappropriately expect you to jump in and solve their problem. You may simply need to bring both parties together for a face-to-face. Responsibility charting is when a role or task may be unclear, or it may be necessary to write down or to delineate between the functions and responsibilities of each person. Third-party consult is an opportunity to sit in as a third and neutral party to help others resolve the conflict. Soothing one party is a temporary solution for volatile and crisis situations where you get one party to simply appease the other for a few days, if not a few hours. It's simply a cooling off period. Behavior change is when you have a serious conflict that may involve a dysfunction that requires remedial training, counseling, EAP, or professional assistance. Lastly, structural change is a permanent solution that may involve transferring or terminating an employee or developing a policy to address the conflict. Now we would talk about negotiation, or the art of the deal. It is important to prepare before the negotiation. You can do this by getting with each party and learning what the conflict actually is, what their values are, their goal is, and ultimately what each party wants to walk away with. During the negotiation, it is very important to listen and to follow the 70-30 rule, which states that 70% of the time, make sure you listen. 30% of the time, you can do the talking. After the negotiation, it is important to be nice and to leave on a positive. If you win more than you anticipate, hide that excitement and restrain it so the other party does not feel sore. It is also important to restate the agreement later, even if it's in writing. Let's take a look at destructive negotiating tactics and things to avoid. Avoid ridicule or being dismissive or intimidating others. One party may use it as a way to get the other party to cower down.
Avoid flattery or excessive or insincere praise, as it only diverts one's focus and really attempts to win someone over. Flattery is deceiving. Avoid or be wary of excessive sadness or sorrow, as it can be deceiving and destructive tactic designed to evoke empathy from the other party. Be wary to avoid showing helplessness during negotiation or the inability to defend oneself. Don't play the victim. Now we review delegation, or the art of the handoff. Delegation is getting work done through others, or by directing others to accomplish the organization's goals. The 5 rights of delegation include the right task, the right circumstances, the right person, the right direction and/or communication, and the right level of supervision. There are errors that one should avoid when delegating. Avoid under-delegating, as it can falsely communicate a lack of trust or lack of ability. Check your inner micromanager. Avoid over-delegating, as it can overburden your subordinates, and it may be a sign of poor time management or insecurity on your own part. Avoid improper delegating to the wrong person, or for the wrong reason and the wrong time, which may include delegating tasks that are beyond one's training or capability. Now we will review how to create a healthy work environment. What makes a healthy work environment? The American Association of Critical Care Nurses describe a healthy work environment as one with skilled communication, whereby the nurses are just as proficient with their communication skills as they are with their clinical skills. With true collaboration, where the nurses are relentless in pursuing teamwork. With effective decision-making, where the nurses are valued and committed partners in making policies, and the nurses are able to direct and evaluate care. With appropriate staffing that effectively matches between the patient's needs and the nurse's competencies, which may be different for a new nurse compared to a seasoned nurse. Meaningful recognition, where the nurses are recognized not only by the facility, but by each other. A healthy work environment should also have authentic leadership, where the nurse leaders are embracing the imperative of a healthy environment, and they are authentically living it. The assignment asks that we grade our current work environment. And for the sake of honesty and full disclosure, and based upon my grading, I made the decision last year to resign and to make it my former work environment. And this is why. Skilled communication, yes, they had it. True collaboration, no, they did not have it. Effective decision making, no, they did not have it. Appropriate staffing, absolutely not. Meaningful recognition, yes, they had it. And authentic leadership? Yes, they had it.
I made the decision to resign. I was finding myself with a tremendous amount of internal conflict, and the conflict was starting to exhibit itself through anger and frustration at my fellow nurses and at my bosses. So I had to get to a point where I can respect myself and walk away from anything that does not serve me, does not grow me, and if anything was not making me happy. And for the sake of this presentation, it also was not making me healthy.
There are some things we can do to improve our work environment, which I did try before I resigned. It is important to empower your employees, to allow them to have input and control over their work, to promote and allow self-care. While self-care, recreation, healthy diet, and exercise should all happen outside of work, wouldn't it be nice to practice this at work, to allow the nurse to take a break, not at the 9th or 11th hour of their 12-hour shift, when it's only convenient with the floor, or to simply avoid the hospital paying overtime. But actually, what about allowing the nurse to take a break in the middle of their shift, where it is truly intended to give them a break, or to allow for hydration and nutrition and relaxation? In my former environment, self-care was nearly non-existent and laughable at best. The next thing we can do to improve our work environment is to adjust the nurse-to-patient ratio, but based upon the acuity of the patient and not strictly bed count. If you have 4 or 5 level 3 patients, that may be doable. However, what if you have a sepsis bundle, a stroke alert, or you have to hang whole blood products? The staffing ratio should adjust to meet the patient acuity level and match the nurse's competencies and proficiencies. In consideration of my future employment, I have learned much about myself. My future employer needs to know that if they empower me, if they listen to me, if they defend me, and if they teach me, I promise they will be able to keep me. Thank you for watching this presentation.